Welcome to Health is Wealth with Dr. Mike. I'm station manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike.
Good morning, Tina, and everybody and all the listeners out there.
Now, Dr. Mike, many of us, especially at this time of year, have resolved to get healthy and perhaps lose a few pounds. You have experience in this area, don't you?
You know, I must say, of course, I've been doing this for a decade in terms of my practice, and weight loss has been a huge initiative that we've been helping a lot of patients. And I must say, for the last decade, I've helped a lot of York region, especially in particular Vaughan, and most of our community in losing weight. And I must say, it's been a huge success for a lot of our patients. And now's the time. Now's the time for weight loss. And I'm not going to lie, my practice is slammed right now because everybody's coming in. Mm-hmm. Everybody's back on vacation. They're ready to rock and roll. They want to take the new year, and they want to, their New Year's resolution is to take their health.
And it's a bit about healthy eating as well as other factors, right?
For sure. I mean, there's definitely, you want to eat healthy is the most important. I think, let food be thy medicine and medicine be thy food is a lot of what we talk about, especially on this show. But most importantly, there's more to it than just eating. And I think that's what we want to talk about today in the show. We're going to talk about what diet is right, what's the best diet to consume, but what other factors need to get in there? And that's things like hormones. Mm-hmm. We got to talk about the hormones for both men and women because, let's face it, Tina, I've been doing this for a long time, but I've had some unsuccessful events in terms of helping people lose weight in the past. And I've learned from those. So things like not taking into account hormones will actually put you in the wrong direction. And early on, when I started my practice and I came out as a nutritional scientist and I came out full force and I said, okay, you know what, everybody, I'm going to change their diet. They're going to eat like this. We're going to get this going. What happens is it's not the whole story. You just don't get the whole story. And what happens is if you miss the hormones and if you don't account for the hormones, and when I mean account for the hormones, well, let's look at, for example, women. Let's talk about women most importantly, because when you're going through that perimenopause, when you're going through that either perimenopause, which is that premenopausal, or menopause, what happens is the hormones get lost. So a female starts losing these hormones, and that's when you get things like the hot flashes.
Okay, so these are some of the symptoms.
Correct. So when you lose some of these hormones, the symptoms are things like thinning of the hair, hot flashes, and these night sweats. But what happens is you lose the body's ability to metabolize fats. And it's a huge undertaking if you don't consider these factors.
And so how do hormones make this worse at this time?
Well, what happens is, the most common problem I get in practice is a female would come into my office or a male and say, hey, look, you know what? I gained 25 pounds in the last year. And that's not really a normal event. That's a little bit much. If you've kept everything the same, what is different? Mm-hmm. And what's different is the hormones. So we're not talking about the thyroid gland, which actually can contribute to this. Let's talk about the hormones: progesterone, estrogen, and testosterone. These hormones actually can contribute and affect a patient in a very negative way if they're not around, especially.
And how do you test for these types of issues in men and women?
Okay, so I like saliva testing. I think it's important. It's important to make this notion. I think saliva is a great tool to test because hormones don't reside in the bloodstream. So not to say it's wrong, not to say that if you get a hormone test via blood, it's wrong. You just got to be consistent. But you just got to remember that the number is not very accurate in the blood versus in the saliva because hormones reside in tissues, Tina. They're actually in the tissues. And so if you want a tissue sample of the hormone, it's actually, the research shows that saliva is a better test. And you can measure this. So you can measure this in women and in men. And it's an easy saliva test, and you can measure it. So with respect to men, we start seeing things like andropause. And this happens after 40. And this is that lower testosterone and more that estrogen gets into play. So that's that big gut that we see in the males. And so what you want to account for this, and you want to look at what this is, where this is at. And because if you're trying to help a male lose weight, most importantly, males, fortunately or unfortunately, they actually lose weight a little easier. Because
you hear that a lot, right? It's so easy.
It's true. It's easier for men because there's really one hormone to account for. But most importantly, they go on a nice little diet. They'll maybe start a ketogenic diet, let's say. We'll talk more about what that is. And what's going to happen is they'll lose weight, but it's keeping the weight off is key. So a lot of people think they can go on a little bit of a diet, go on a ketogenic diet, lose a whole bunch of weight, but it's keeping it off that's key. And are you going to stick to that diet? So these fad diets, really, you have to consider whether this is something long-term. And then what's going to be the sustainability? How are you going to keep this weight off? And that's when hormones are going to be the most important.
All right, let's hold it right there. When we come back, Dr. Mike shares the best diets to help you lose weight and keep the blood sugar and cholesterol at bay. This is Health is Wealth on 105.9 The Region. Stay with us. Welcome back to Health is Wealth. I'm Tina Cortez, and my co-host is Dr. Mike Carrozza. And Dr. Mike, you wanted to focus next on 3 specific diets.
Yes. I mean, fad diets are really, there's a lot going on. There's a lot of diets right now. A lot of people are considering which diet to follow. I'm not going to talk about intermittent fasting because that's a hot one right now. Mm-hmm. I want to talk about what diets I think are the most important, which ones work in practice. And then I'm going to give my take in terms of what happens to these diets, what kind of problems can ensue as a result of these diets if they're done wrong, and if you don't have the proper supervision. So, let's touch base on these. And the first one is the ketogenic diet. Tina, you heard about this diet, right?
I've heard about it, but let's explain it one more time.
So the keto diet, it started off, it was mainly for patients with seizures. And so it's a high fat content diet that actually causes the brain to become highly concentrated with fat. Now we know this, and we talked about this in our earlier sessions, is that the higher the fat content, our brain is comprised of 40 to 50% fat. So it's a huge fat component. So we want to get the right fat. So, you can even do keto wrong and have the bad fat. So you definitely want to have good fats. And so it's a high fat, low carbohydrate diet. But we can help a lot of people with neurological issues such as Alzheimer's, epilepsy, Parkinson's, patients with seizures and whatnot. And then, even type 2 diabetes and PCOS is important as with this specific diet because it's the low in the grains and higher in the fat.
But if you're having a high fat diet, doesn't that have an impact on your heart health, your cholesterol level?
Yeah, you're right. But I mean, this is where you can get it wrong.
Okay.
And this is where you'd have to see somebody like myself. And I brought on one of my colleagues, Dr. Ryan Shakitano. He's here this morning, and we're going to talk a little bit about the diet and his expertise and talk about also exercise and how this is important in keeping this at bay. Because we talked about this earlier. We talked about it's not just about diet. It's about exercise, metabolism, how to keep things going. So, with respect to the ketogenic diet, I like it. I think it works, but if it's done wrong, you're going to have an issue. And this is where things like high cholesterol. So you think that increased fats. What kind of fats? What's a good fat and what's a bad fat? So does it mean you can have margarine? Does it mean you can have a lot of mayonnaise? So this is where we'd have to actually help our patients, because the answer is it does mean that, because the diet doesn't really go into as to what types of fats should be consumed. But when you look at the research, and my specialty and my expertise is that the good fats is where it's all about. And so things like avocados are going to be better. Things like omega-3 fats, from fish, right? Some wild fish. And also you want to get things like grass-fed beef, which have more of that high omega-3 and that high anti-inflammatory content, because at the same time, we can get an inflammatory or like a pro-inflammatory condition, and we could exacerbate some of these issues that you already have. So if it's, for example, arthritis, you want to make sure that you have this in check as well. So when we look at things like the paleo diet, and this is the the caveman style diet. And so the difference between this diet and, let's say, the ketogenic diet is that, it doesn't include things like dairy products, and it has legumes, but it consumes more fish, vegetables, nuts, and seeds as well. But you're mostly consuming lean meats, and then things like sweet potatoes. And so it could help lower things like triglyceride, your blood pressure as well. But the idea is you can still do this wrong, because the high protein content could actually do things like damage your kidneys. Okay, increase things like uric acid and cause things like gout.
How do you know which one is right for you?
So
Because there are a lot of diets out there. You've only listed a couple here, and we've talked about a couple. But how do you know which one is the right one for you, your body type, who you are?
that's when testing is important. And that's when I think the most important is you want to test for foods that cause or create inflammation to that specific person. And that's the thing that we do different in my office. And we like to test our patients for certain foods. And so a food sensitivity test, we look at the inflammatory markers that actually will trigger pro-inflammatory mediators, if you will, or pro-inflammation in the body that'll actually give rise to weight gain because it's going to cause a redistribution of water. So based on that, so wherever inflammation goes, water goes, and then you start swelling, and that increases things like weight. So that's just one example on how to utilize and customize a diet for a certain person. So, you made a good point. You're like, which one do you stick to? I like to balance it. And so I'm going to talk about that in a second. I'm going to talk about how I take little bits of these particular diets and I put it together, and I like to call it the Dr. Mike's diet. This is what I call...
Very personalized.
I do personalize it in my practice, and I think it's important because I can't say to somebody that comes into my office and say, oh, you got to cut dairy out. Well, I need a reason. I have to suggest that maybe you have some kind of intolerance to it. So we'll do some testing. We'll check some urine tests. We'll also do some blood testing to see what foods maybe you're intolerant to.
So you should be prepared then for a few tests, whether it's a saliva test, a food sensitivity test, a urine sample, and a blood test, right?
Correct.
Okay.
This is how, in my experience, this is how you can actually help somebody with this and see success. Because there's nothing worse than hiring somebody or asking somebody for help and you failing miserably. When you go to any kind of coach in any sport, you want to ask for the right advice, but you want to make sure that person who's talking to you about that specific sport has actually played it, or if actually seen something that can shed some light, say, look, I used to do this as well, but now this is what I do. So I've tried every diet. I've looked at it, I've tried it, I've studied it. And so I put myself through every single diet there is out there. And so I know what you're going to feel. I know what you're going to exhibit as a result of being on this diet. So that's why I put together my own diet that sort of puts together a little bit of information. So another diet I want to talk about, which is extremely getting a lot of traction, is the vegan diet.
Lots of popularity.
Lots of popularity right now. And so we know that when you're talking about inflammation, right, and you talk about things like cancer, because having red meat and cancer, and we'll talk a little bit about the studies in a bit, but when you talk about like eating red meat, it's definitely going to consume more of a pro-inflammatory condition. And then things like there's research now out there to suggest that, plant-based diet can ward off things like diabetes, cancer, inflammation. And this is there. But I mean, these diets can backfire as well. A vegan diet can backfire. Why, Tina? Why? You're going to ask why. I know you are.
Absolutely.
And so you're going to say, well,
because it seems so much healthier than everything else.
But guess what? I can eat a vegan diet and I can eat a plate of pasta every single day, or like even twice a day, and I can have some bread with my pasta. And so I can carb overload.
Yikes.
Okay. And I can say I'm a vegan, or I can get some Vegenaise and eat some toast bread and have that twice a day or 3 times a day as a snack. So, with this idea of being vegan, there's limitations to it as well, because we can't just say, oh, I'm vegan, but now I'm going to go eat a processed burger that's not made from beef, but it's processed. So where do we find? So, I mean, I got an example of a good, so I went by Nature's this morning. Of course, we got our coffees, we got organic coffees, and definitely our nice juices. But I went by and I grabbed a Mediterranean salad because I love what this adds. So I'm going to describe this a little bit. So for our listeners out there that aren't watching, there's some cucumbers diced up, some chickpeas, and we got some arugula, and we have some olives and a couple cherry tomatoes. For some of my patients out there, they're listening. Dr. Mike, you said cherry tomatoes are no good. Well, there's 2 cherry tomatoes, okay? And there's some feta cheese, okay? Now, this is organic feta, and it's from sheep. So feta cheese, just so you know, Tina, is made from sheep milk. Okay, so which is a little bit definitely a healthier option than the cow. We know this, all right, because these are grass-fed animals. And then on the bottom, there's a little bit of quinoa. You can't see it, but something like this is predominantly like vegetarian because there's a lot of vegetables here.
Sure
there's
is.
a little bit of a grain that's a whole grain. Okay, and then you got a little bit of protein source from the dairy,
cheese.
from the cheese. But let's just say if you didn't want the cheese, well, you can just take the cheese out, and then the bean and the quinoa together are going to activate the protein to have the complete amino acid spectrum, so which is what you want. So you get a little greenery in there. I like this salad because it gives people options. So this is the example of combining and having what you'd call a Dr. Mike's diet, because this is not a ketogenic diet because it has grains. Okay, and this is pretty much not a paleo diet because it has a little bit of the greens as well. But guess what? It has a little bit of both to help with a little bit of the majority of people's issues. And so the number one issue is balancing out blood sugars. I think that's the key as well. So we want to try to get this done. And then the other thing that you could come into some trouble with if you're consuming some of these vegan diets is that you can come into some problems with things like genetically modified organisms, so GMO foods. And then these are the starches. And so you can consume a little bit too much of this. And so this can actually backfire and give rise to a lot of the autoimmune disease which we're seeing today.
Anyone who's listened to this show in regularity knows that you always say everything in moderation. Don't do anything to an extreme, right?
Correct. Yes. When you do it into an extreme and you go to the next, so like if you follow one of these diets, the ketogenic diet, the Paleolithic diet, if you follow it to its entirety and you just stick to it and you just like, oh, I just want protein, I want to stay away from carbs. What's going to happen is when you fall upon these diets and you actually don't continue them anymore, and you've, let's say, met your goal, what's going to happen to your body when you introduce the carbs back in? Are you never going to eat carbs again? Is your body going to forget? Is the sugar going to break down and then your body's just going to forget? What happens when you come into that moment and that you want to have a carb, that you're going to have a carb? Your body actually is going to forget how to metabolize it. So you don't want to lose that. You want to actually make your body's functions in terms of the digestive system to actually get itself in the active state. And that's the key.
Final thoughts before we wrap up this segment on the diet part of it?
Final thoughts. So first off, too much protein is no good. We talked about the uric acid issue. Pro-inflammation is a key, so you want to make sure you use more of the anti-inflammatory things like the grass-fed beef and the omega-3 eggs. You definitely want to look at good fats. The bad fats are going to cause a problem, and if you're doing more of the ketogenic diet and you're consuming more of the bad fats, you're going to get into some trouble with things like heart disease. So be careful and always consume good fats. And if you want to know about what fats are good, you can just look them up. It's really easy. And then I think the benefits of these diets are you're going to look at things like reversing things like diabetes, helping things like your cholesterol, and definitely increasing your energy and metabolism. And then for neurological conditions, you're going to get more out of your brain and having more brain power when you're putting more beneficial fats in there.
When we come back, an athlete, naturopath, and nutritionist, how the experts help in the weight loss challenge. This is Health is Wealth on 105.9 The Region. Stay with us. Welcome back to Health is Wealth. I'm Tina Cortez, and my co-host from AppleMed is Dr. Mike.
Tina, I'd like to welcome our newest member to the AppleMed team. He's not only an athlete himself, of course, he brings a whole nuance of naturopathic medicine and sports nutrition with him, as well as exercise metabolism. So I'd like to welcome Dr. Ryan Shakitano back on the show.
Thank you both very much for having me.
No problem. So we're talking about diet and nutrition, of course, which is a part of your forte, which is something that obviously you and I both live by, right? And so what I want to talk to you predominantly about, we went through a couple of the diets. We talked about the Paleolithic diet. We talked about the ketogenic diet and the vegan diet and most importantly, and I think you see eye to eye with this as well. I know this is having little bits of pieces of these diets and putting them all together is probably going to be the best and in moderation. So we talk about things like daily consumption of vegetables. We want to increase moderate consumption of dairy products, of course, and then limited the amount of red meat and more fruits and vegetables, which is something that we pride ourselves on. In terms of the studies, the red meat consumption has been linked to increased things like cancer and diabetes. And then, there was one study that I thought was really interesting is that the vegan diets in terms can result in greater weight loss than the vegetarian, the pesco-vegetarian, and the semi-vegetarian and diet. So basically, there's a lot of research right now on the vegan diets, and of course it's anti-inflammatory. And I guess what I want to talk to you about is the importance of testing a person for their individual food intolerances. Like, what are your thoughts on that?
I think it's critical, absolutely critical. So the more I do those tests, the more I see foods that people think are generally healthy. And it's like, oh, wait a second here. What's going on? Like, what's good for me might not be good for you or you. There's sort of that variability person to person that I think is really important to account for in testing.
And I think that it's that uniqueness, right? That it's that every single patient, it's that individualized treatment. I think that's what naturopathic medicine is all about. And when we're doing this and we're testing this, the premise of this all is inflammation, because we know that inflammation is the root of all, predominantly all issues, right? Whether it's heart disease, whether it's even Alzheimer's or this neural inflammation or there's gut inflammation. Inflammation is a problem in our society, and we got to control it.
And I think there's sometimes some confusion around the term inflammation, because we think of that, frankly, as swelling, and it's not that.
Correct. It's not that. I mean, we need the swelling. We need those kinds of inflammatory conditions to actually protect us. If we fall, if we have a traumatic event, the swelling is going to save our life. It's our body's ability to become pro-inflammatory a little too quickly, a little too aggressive when it's not necessary. And this is what's happening today in society. And this is where we think that, testing somebody, testing individual, and we can look at this. And so, Dr. Ryan, as being an athlete, of course, you always had to keep yourself in the most physical of state. And so is diet is there more to it? Like definitely, it's not just diet, right? What else can a person do to maintain their physique?
Absolutely. So just as an example, you could get the best workout in the world and feel so great after it. But if you're not sleeping properly, you're not going to get that recovery. You're not building muscle in the gym, you're breaking it down. And it's what you do after that helps you recover and build it back up. Sleep being one of them, nutrition being one of them that you guys talked about as well. And on the nutrition side of things, it's doing things that make it sustainable over the long term. And I think you guys touched on this before, which is awesome. When you do things in the short term that aren't sustainable over long term, I'm sure you guys have seen it where people go on these chicken breast and salad diets for 6 weeks, they lose all this weight, and then what happens? They go back to the way they're eating before and they put all that weight back on.
Then some.
And then some, exactly. So it's that sustainability component for athletes and general population that I think is absolutely critical.
And it's probably the most important because and we talked about this. It's like, I go on a carb-free diet, I feel good. I mean, and what happens after when you touch that carb and you start eating that carb again and then your brain sees it, it's like, boom, you just blow up, right?
Yeah, and that low-carb diet itself. So people go on low-carb diets and think, oh, I'm losing all this weight so quickly, it must be working. Well, the carbohydrate molecule associates with a water molecule in its storage form. So glycogen itself contains water. So when you shed that, you're going to lose weight. So people think, oh, I'm losing all this fat on this low-carb diet. It's working so quickly.
Exactly.
It's like, no, it's not, right? And it gives people this false sense that things are working quickly, and results that tend to occur quickly tend to go away quickly.
And why is it a good idea then to seek the help of a naturopath and a nutritionist, maybe in combination?
Well, we actually see this in practice. I mean, this is part of what we pride ourselves on. I mean, the whole idea, our premise is individualized treatment. It's because if people can do this on their own, then they probably wouldn't need us. And it's accountability. That's number one, right? That's a huge one. And number two, it's putting this all together, and not only what works and basically what we've done in our practice and our experience, but most importantly, what we see is going to be the best outcome to get the patients well. So you can shed that quick 10 to 20 pounds. You look good on the outside. Well, what's going on the inside, Dr. Ryan? What's going on with your arteries? What's going on with the inflammation in your heart? These are some of the things we account for, correct?
Exactly, yeah. And along those lines, when we're talking about testing as well, it's like that really brings that individualized component to it. So I think that's absolutely critical. You're right.
And, a lot of patients come into the office and they say, doc, I don't have time. I can't go to the gym. I can't work out. Like, gone are the days that you have to be in the gym for 2 to 3 hours, correct?
Yeah.
Like, what's a realistic, like, what can we tell our listeners? What can we tell our patients? I mean, we need physical activity, but like, we want to make it sustainable, as you mentioned. Like, what can you suggest? You're the expert in this field for sure. Like, what can you suggest? Something easy, an easy regimen. What are your thoughts? What can you shed to some of our
generally
listeners?
speaking, with workouts, it's same thing as nutrition. One size does not fit all. You have to sort of find that workout that works for you. And one of my gauges for that is you should be doing workouts that help you feel energized when you're done. If you feel beat up, toast for the rest of the day, you're not on the right track. Absolutely. So you need to find something that works for you. And again, like Dr. Mike said, it's not a 2 or 3 hour thing. you can push the intensity for very short periods of time, and then you're coming back feeling, oh, I'm actually more energized now, right? So it's finding what works for you. And I find high-intensity interval training is one of those things that can work. You guys were touching on hormones earlier. There's some amazing compound weight exercises you can do. We talked about squats, I believe, on previous show.
Yep.
That's a great exercise when we're talking about testosterone boosting. So many different things you can incorporate high intensity, but not necessarily long duration, that makes exercise a realistic part of pretty much anyone's schedule.
So what time will we give us some time frame? So like just for our patients out there, how many times a week and how long do I need to sort of be there in the gym? What can you recommend?
You can as little as 20 to 30 minutes a day. So my minimum is 30 minutes a day of physical activity, I would say, in general for most people. You can push the intensity to where you sort of like in that sense. But the higher intensity you can go in that short amount of time, the better. And it's not necessarily like a long distance cardio as an example. Again, when we're talking about hormone function, that's probably not the best idea either. So half an hour a day is sort of my gauge, but it, again, depends on the person. There's such an individualized component, and that's where we come in when we're talking about putting together plans for people that are absolutely specific for them.
Yeah, and you don't have to push yourself, Tina. You don't have to hurt yourself. You don't have to go into the gym and try to rip some of your muscles apart. Like, this is not the idea. The intention is all about trying to get something in moderation. We want to get you physically active. We want to get you sleeping. All right, so maybe before we wrap out, let's talk about a few things that we do, Dr. Ryan and I. So IV therapy, we do that as well, and that's for nutrient and replenishment. Okay, so that's intravenous vitamin therapy. We use herbal medicine to get the hormones back for both men and women. I think this is a huge modality that we have in our practice. And then the nutritional supplementation, which I want to talk about, and I want to have Dr. Ryan's first choice in terms of his favorite for weight loss. What can you, last thoughts in terms of what you like in terms of supplementation?
It's more a general sort of approach to it, vitamin D being huge for it. You can supplement. There are a couple studies out there saying caffeine before a workout may help stimulate fat burning. So that might be a potential avenue.
That black coffee, right? That
Exactly. Yeah, when dosed properly, for sure. But vitamin D is something I see when we're talking about inflammation as well. Any autoimmune condition I've seen has always had vitamin D that's low.
Yeah.
When we're talking about inflammation. So that's where I'll turn for sure.
For sure. My favorite is carnitine right now. I like carnitine. It actually utilizes fat in the body and actually will break it down and utilize that fat for energy. I like carnitine. I also like omega-3s, as we talked about, to get that good fat, decreasing things like inflammation. And then don't forget about the key vitamins, vitamin B6 and vitamin B12.
Okay, weight loss is a conversation we're going to continue to have these first few months of 2020, Dr. Mike.
You got it.
And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you and your team, how can they do that?
So they can reach us at www.applemed.ca. They can check out our hashtags on Instagram at AppleMedClinic. They can call our office at 905-417-4000. And Dr. Ryan and I will be happy to help patients, achieve their goals and see optimal weight loss for 2020.
That's our show for this week. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. I'm Tina Cortez. Thanks for listening.